Alarming signs to find out if you are experiencing a panic attack. A panic attack can be considered one of the most intense and unsettling experiences that someone can have. It feels like the whole world is spinning out of control, your heart is racing, and you may feel like you can't breathe. If you are experiencing such kinds of symptoms, it is crucial to determine whether this is a panic attack or something else. These questions help you determine if what you are dealing with is, in fact, a panic attack. Are you feeling overwhelmed? The first crucial question to ask yourself is whether you feel overwhelmed. If this sounds familiar, it could indicate that you have a panic attack. Panic attacks often start with feelings of fear and unease that become increasingly intense until it feels like all of your emotions have snowballed into one giant ball of emotion. Are you experiencing shortness of breath? One of the primary physical symptoms associated with a panic attack is shortness of breath or difficulty breathing. People who experience a panic attack often struggle to take deep breaths or feel as if they are not able to get enough air into their lungs, no matter how hard they try. If this is happening to you, then it's likely that what you're experiencing is a panic attack, instead of just anxiety or stress. Is your heart racing? Another common sign of a panic attack is an increased heart rate or palpitations, the feeling that your heart has skipped a beat or two, which could indicate an abnormality in your heartbeat rhythm during the episode. If this sounds familiar, it could be another sign that you're experiencing a panic attack rather than just general anxiety or stress-related symptoms such as butterflies in your stomach or jittery nerves. Are you feeling dizzy? Another physical symptom associated with a panic attack is dizziness caused by hyperventilation, or taking too many shallow breaths without exhaling deeply enough, which can cause lightheadedness and even fainting spells in some cases. If this sounds like something that has been happening to you, then there's a good chance that what you're dealing with isn't just everyday anxiety, but rather a full-blown panic attack accompanied by physical symptoms such as dizziness and lightheadedness due to hyperventilation caused by rapid breathing during the episode itself. Are you experiencing chest pain? Alongside shortness of breath and increased heart rate, people who experience panic attacks may also experience chest pain, which could indicate an underlying medical condition like an impending heart attack or other serious issues such as asthma, which should be addressed by medical professionals immediately if noticed during an episode. If any chest pain accompanies other physical symptoms mentioned earlier, then it could be another indication that what you're going through isn't just everyday anxiety but rather something far more serious, such as an impending medical emergency requiring immediate attention from medical professionals for further evaluation to ensure proper diagnosis and care accordingly. Other symptoms. Are you sweating profusely? Nauseous? Shaking uncontrollably? Feeling detached from reality? Having difficulty concentrating on simple tasks? All these, alongside other physical signs mentioned previously, could be indicative of many different things ranging from normal everyday stress and anxiety to more serious concerns such as potential medical emergencies requiring prompt attention from medical professionals right away for further evaluation accordingly. Therefore, any combination of these signs mentioned, along with other physical sensations, should warrant further investigation when they occur together, since they could potentially indicate much more serious issues than just normal everyday anxious feelings. Importance of understanding the signs and getting help from experienced medical professionals. Panic attacks are frightening episodes that can leave one feeling helpless and out of control. However, being aware and familiarizing ourselves with the signs associated with them can help us identify. Knowing when we're having an episode helps us remain calm during times when everything else seems chaotic around us, so we can better assess our situation appropriately for the best results moving forward. Always remember to stay informed about signs associated with possible panic attacks. Keep track of personal triggers. Pay close attention to bodily responses. Prepare for future episodes before they happen. Prepare yourself, that way, we will never have another episode again without knowing exactly how to handle them properly. By understanding our triggers for these episodes, keeping track of our signs, and paying close attention to our body's responses, we can better prepare ourselves for future episodes before they happen to ensure better outcomes. If you want to discover more about yourself, please subscribe, like, share and hit the bell icon.